Okay, ladies and gentlemen, let me introduce myself. First, I'm a member of the European Parliament from Czech Republic. I'm working in the SANT committee, which is the new committee on public health. Before I was 20 years a health lawyer in the Czech Republic, dealing with all sorts of public health regulation, so this is a topic interesting for me. I'm a classical liberal and a lawyer, so my speech might be a bit boring. Sorry for that. There are some principles I would like to mention anyway. First of them is before we regulate, we should, how do you do it, alter listen to all the parties involved in or targeted by the regulation. Only then act, and after then take a look at what the regulation is doing to see if it brought benefit, or if it brought nothing, or if it even brought harm. And concerning this, the examples included in this report are very instructive. More generally, when making regulation, we should follow European values. My European values are autonomy, subsidiarity, and proportionality. Some of them are much older than the European Union, hundreds of years older. They stand for the philosophic background of the European society. First of all, concerning autonomy. My opinion is that we belong to ourselves. So, if the regulator comes and tells you what to do, he needs really to have a prevailing reason. One of these reasons is objectively the interest of third parties. For instance, in the case of passive smoking, yes, there is an interest of third parties, of their health, which empowers the regulator ethically to regulate on this area. On the other hand, if no third party is involved, the question is, why is the state taking the role of telling you what to do? Generally, and I'm starting with this intentionally, I'm a bit skeptical about these targets that we will reach this or that, because the purpose of us as people is not to be a target for 2040 or whatever. Our task is to live the lives according to our free choice, and the role of the states is to serve us, but not to teach us. Paternalism belongs to the family. I, as a father of three, I'm supposed to tell my children you should do this or you should not do that. Paternalism belongs to some extent in modern times to the relation between doctor and patient. The doctor should at least advise the patient, do not do this or do not do that. But I don't believe exactly that paternalism belongs into the relation between the state and the citizens. The state is to serve. The citizen is the person who chooses what he does or doesn't. So this is my starting point, and this is why I warned you that I'm a classical liberal, which is a dying species in this parliament, unfortunately. And you hear all the times about these targets we have to follow, and this brings me back the memories of unfortunate times of totality, because when the person becomes not an autonomous being in itself, but starts to be a part of a target issued by the state, well, it's not so good all the time. It sounds nice, but it is not good. Second thing of my boring theoretical is subsidiarity. The member states are the masters of the European Union. They created the European Union in order to gain better prosperity. And they can also anytime exit from the European Union. So it is the member states. It is sometimes wise to regulate on a lower level than on European Union. We are different from this, from other big federative states, that we have different cultures. And sometimes it might be wrong if a state or community A, which has cultural habits X, tries to say to state B, which has cultural history Y, that should not do Y and should do X. We are full of these examples, so we always have to ask in this building, even if we consider it is a good thing, whether it is not better left to the member states with their cultural differences, and whether we should step up as a European body. In many of these cases, we think that the states should be the regulators, and I think the cases of Czech Republic, Sweden, Greece might be good examples on this. Of course, this doesn't preclude harmonization towards single market. Of course, we have to adopt in some things. Sometimes, for instance, in the area of advertisement regulation, the European action might make sense, but only to a limit, only to an extent. For myself, I have to mention it here, completely unacceptable is the TEDOR proposal, tobacco excise duty on resource thing, which would basically be a new European tax. I think the European Union should be satisfied with the money we already give, and if some money are taken as taxes from this area, they should serve the states, the state resources, the national systems of health, education, and so on and so on. So this is another point which is important. By the way, it is very interesting to take a look at the Czech example. It might be interesting to see what was the cause of the decline and if there were more causes. You have seen it is 2020 to 2022. In Czech Republic, smoking cigarettes was mostly a social thing, something you do with your friends. So the first big hit was when it was prohibited in pubs. The consumption declined a lot. And then everybody went to the outside of the pubs and to the streets and smoking in the streets. But then came COVID, you get these face masks and you couldn't go to the streets. So there was basically no point, no place to smoke with your friends. So this was perhaps one of the reasons why it declined. Another was that young people weren't meeting. In my age, I'm not a smoker myself, but all my friends learned to smoke when they were like 13 years old in the playground. And during COVID, it didn't happen. It had also some bad consequences, like the people are depressed. But basically, this might be one of the cases. But still, the regulation which we had in place made some sense. And this brings me to the third and last point of my speech, and this is proportionality. We should always test if the means are justified by the ends. Firstly, we should respect the medical maxim primum non nocere. First, do not do harm. We have seen many prohibition cases in the history of mankind. For instance, the US whiskey, the Soviet Union, the vodka, but also we have seen others where the hard prohibition only brought socially destructive structures, mafias and so on, and also dangerous products. So hard prohibitions do not tend to serve very well. The harm mitigation is much better strategy, and this is once more shown by the examples which were here, that it can work pretty nicely. The proportionality brings me to another issue, that all products have different kinds of dangers and different levels of danger. So every product or category should be judged case by case basis, otherwise the legislation is not proportional, and this is wrong. This applies the same for all kinds of products. In each case we have to ask, should we regulate at all, or is it something which should be left to the free choice of the people? If we decide the necessity of regulation is there, on which level should we regulate, on EU or state level? And only then we should ask, what tools should we use? A regulation of advertisement, taxes, prohibitions. And I think hearing the cases like this and taking a look retrospectively on what each kind of regulation is doing is something we should watch very closely in the subcommittee and use it as a leading force for our decision how we will vote and how we will regulate. Thank you very much.